The first part of the follow-up, I just ask patients if they're having any problems with food getting stuck, vomiting, severe acid reflux, diarrhea. After a switch, usually you should be having 1 to 3 bowel movements. If you're having more than that, I want to kind of talk about options.
One other issue that we all often address at our postoperative visits is the issue of heartburn. So we tell you preoperatively, heartburn can develop in 5 to 10% of patients that never had heartburn before. That can come from the way that the stomach is reshaped into a sleeve and increase in those intragastric pressures. That increase can force fluid back up in the esophagus. That's a disease process called GERD, or reflux. And reflux can develop into symptoms that we call heartburn, that typical burning in the chest sensation from those acidic fluids that are washing backwards into the esophagus. We often want to know whether or not that's developing in a patient, but typically won't deal with that immediately postoperatively, because as you're continuing to lose weight, your intra-abdominal pressures are going to go down. And that may normalize all these changes and allow heartburn to subside as time goes on. And so I'll generally watch it for 8 months to maybe a year to determine whether those symptoms are persisting. And if they are, there's some things that we can do about that long term.
Other things we talk about that's important is vitamins. With the sleeve gastrectomy and the switch, those are very important. And making sure that you're taking them, daily. You're taking a good multivitamin along with B12 or a B complex and your calcium. Now, important things I tell patients as far as vitamins go is as long as you take it, pretty low chance of vitamin deficiencies. But if you quit taking it, particularly with the switch, you can get vitamin deficiencies. Also with the switch, it's real important to take calcium. Try to do that 2, if not 3 times a day. What we've seen is that calcium helps bind what's called oxalate. And if you're not taking it, that oxalate level can build up in your body and can cause kidney stones and even some kidney insufficiency. And so real important to take those vitamins. The other things that I like to transition into is just talking about medication changes. If there's been changes in diabetic medications, high blood pressure medications, and particularly making sure that the primary care or the cardiologist is involved in helping manage that.